On this episode, we will talk about when it's a good time to get plastic surgery after your gastric sleeve. We'll also talk about intermittent fasting with your gastric sleeve, and we'll talk about getting a cold right with your surgery. Would we postpone your surgery? Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 199 of the AskDrA show. Thanks so much for joining us and being part here of the channel. If you're interested in weight loss surgery, gastric sleeve content, or weight loss in general, be sure to hit that subscribe button and that bell notification as well. And if you want me to answer your questions, or you have some questions you would like to be addressed, be sure to have that question throughout social media and use the hashtag AskDrA. That way my team will be able to grab those questions. I'll line them here on the queue and I'll be more than happy to answer them for you. Let's get into the show. All right, so the first question is, okay, Dr. A, when is it a good time to look into plastic surgery after weight loss surgery? Well, this is very simple to understand. Obviously, it's not right after weight loss surgery. You got to give your body enough time to heal normally, and then to recover, and then to have that effect that we want of weight loss. And once you're on the weight loss phase, that will usually be maybe 10, 12, 18 months. During that time, you will have some plateaus, some stalls, which are normal, which are needed, and your body's going to be adjusting. So you please don't misunderstand that those stalls is the perfect time to get weight loss surgery. Okay, I'm done. I'm not losing anymore. You're probably at a stall. This stall may last some weeks, maybe in a month or a couple months. So it varies on everybody. So please don't misunderstand that you're in a stall and that you're not losing and you should look into plastic surgery because you're not losing anymore. No. So time frame, it's at least 12 to 18 months. Or maybe you didn't have to lose that much and you hit goal at 10 months and you don't have much to lose and you've been at a stall since then it's a good time, depending on what procedure. So no sooner than 12 months, that's pretty much the rule. And if you have any questions in particular, your plastic surgeon will let you know, because he's going to ask you, all right, when did you get weight loss surgery? When did you get your gastric sleeve? Well, so long ago. All right, are you still losing? Yeah, I'm still losing. No, it's not a good time. You got to wait, all right? Or I'm at a stall, I have no more, look at my body, I have no more weight to lose. All right, we can start looking into it. So a plastic surgeon will be a really good indicator to let you know, all right, it's a good time to proceed and look into plastic surgery. So normally no sooner than 12 months, and then after that time, once you have reached the stall, your body has been nice and regular, it's a good time to look into plastic surgery. Okay, question number 2, very controversial, and I like to address this question because I do this and I practice intermittent fasting. I fast every single day for 16 hours, and I have a window of 8 hours where I eat, all right? But the question in particular, this patient is asking me, what do I think for fasting 24 hours with a sleeve? That I don't like. Even though today I just finished a 24-hour fasting cycle myself, all right? But I don't like it. I'm not a sleeve patient. I wish I was. Life would be much simpler. But anyway, if you are a sleeve patient, I don't like the idea of patients fasting longer than 16 hours, all right? So if you're gonna be fasting, have a time window of eating of 8 hours, and you can fast for 16. You wanna take it on the safe side, go ahead and take some omeprazole, 20 milligrams at least once a day, in the evening, actually. And even better, if you can double that, 20 milligrams in the morning, 20 milligrams in the evening, that will protect your inner layer of their stomach while you're fasting from the acid, and you'll be fine. So fasting for longer periods of time, it may be a religious belief or a religious purpose. Would I recommend it? I don't like it. If you do it like once a year, will something happen? The answer is no. And even if you protect your stomach, well, the answer is no. It's even better. But for a sleeve patient in particular, again, I don't like the patients fasting longer than 16 and having a time window of 8 hours. I hope this helps. All right, and our last question is, all right, Dr. A, so if I get a cold, will my surgery be postponed? Most certainly yes. Most certainly yes. This is what we do here is with weight loss surgery is an elective surgery. This means that this is not an urgent or an emergency surgery. This is something we have been planning. This is something that we are lining up the ducks for you to be in the best shape possible and make sure everything is good the day of surgery. We do blood work, make sure you're not anemic. We check your heart, make sure it's in good shape. We do a chest x-ray, make sure all is good. And we do all this just to make sure everything is perfect or in the best optimal condition the day of your surgery. And getting a cold is not ideal. Even worse, if you have fever, then it'll be postponed because that means you have an infection, all right, viral or bacteria, you have an infection, all right? So let your doctor know. Very important for future patients, or if you're looking into the gastric sleeve or you have it scheduled, please take care of yourself. Stay away from people who have a cold. I mean, try to avoid unnecessary going over to the mall, to the supermarket. I mean, you're getting surgery, all right? So take care of that spot. It's hard to get those spots for weight loss surgery. Hold on to it and take care of yourself, because if you get a cold, and if it's a severe cold, yes, most certainly your surgery will have to be postponed. All right, so there you have it. That is it for episode 199 of the Ask Dr. A show. If you found this useful, leave me one of these. It's very useful. I appreciate your support here on the channel, and be sure to subscribe for more videos in the future. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.